So this is my third video on weight loss medication. And if you missed the other two, just scroll back and have a look at them and see if it's something you're interested in or not. So a common issue is, how do I come off this medication? I've lost weight. I feel very happy. Now what do? Do I just like stop it dead? What happens? Am I just going to gain all the weight back? And unfortunately, research has shown that within 2 years, I think it's 2 years, 70% of the weight has been gained back. So obviously, that's not ideal and can be very disheartening. So how do I avoid this with patients? So I don't just stop the medication instantly. You wean up the medication dose by dose over months. So what I do when a patient has reached their target is wean them back over a number of months. And this weaning down process could take 6 months. But I think that's better to do it slowly than to just take someone off their meds and all the weight goes back on, which I have seen. Patients have chosen to do that themselves. They've got to where they want to be. They're like, oh, I feel fine now. I'm going to stop taking the meds. And within 3 months, they put on all the weight. It's very, very disheartening for them, for me, for everyone involved. It's an expensive process. The medication via our clinic is roughly I think £175 to £195 a month. So, it is a cost investment, although I have heard certain clinics charge like £1,000 a month. I mean, that is a hell of a profit margin, I'm telling you. So I do think that, cost, of course, is a factor for these sort of medications. I haven't said actually, there is actually an oral version of these medications, but I tend to see weight loss is so much slower and also side effects tend to be more. So it's not really my preferred choice, but if someone's really needle phobic, then I do often recommend that. By the way, the needle is like this big. It's absolutely tiny. You can barely feel it. So I think that's also worth mentioning. I had 2 patients who really didn't want to go on the injections and they lost some weight. Just really wasn't fast enough. They've been doing it for 6 months and they've lost a stone. And I'm like, yeah, I mean, that's good, of course, but the half a stone they had to lose then came off in 2 months after. So with the injections, when I convinced them it would be okay to use the injections and to give it a go, and it's really not that painful. I understand why people are needle phobic. Like, I'm a doctor, I'm used to being around needles a lot, right? But injecting yourself is something different. And these are little subcutaneous injections that just go into the skin. I once had to give myself an intramuscular injection and I really couldn't do it. Whoa, it was very, very intense for me. So, and I never did it again after. So I do understand it's not easy to learn to inject yourself. So yeah, my approach is just to wean someone off slowly. And of course, if you've been making dietary changes throughout, not just eating less of bad foods, but looking at your protein, looking at your hydration, looking at how you're moving your body, fixing up your hormones, fixing up your gut health, then you are going to get the benefits. I've mentioned side effects in the previous video, normally quite gut related. And often I tend to see people having a lot of gut related side effects. Maybe it's because their gut isn't optimum. So then is that a good time for us to be looking at, balancing gut flora, taking probiotic supplements, taking enzymes, taking anti-inflammatory gut supplements to help reduce inflammation in the gut? All these things can be of benefit alongside the medication. So I think doing the medication, it's a personal choice, of course. It's not for everyone. I've offered it to some patients and they're like, no, that's not for me. And I totally respect that. But if you do choose to take the medication, I think it should be done in a sort of holistic approach. It's a lifestyle, not just a quick fix to lose weight, but it's certainly an extremely, extremely useful tool. So I hope you found this helpful. And if you have any questions about weight loss medication, please feel free to contact me and I can see if I can answer them.